Hi guys, my name is Rejoice. If you're new here, hi, what's up? Thanks for checking the channel out. Okay, if you're returning, what's good, Chi? What's good? It's funny because I had this professor in nursing school that was like, my G. Anyways, thanks for coming back if you're returning. So I'm just here to basically share some of my knowledge that I have just to help you navigate the different choices nursing school has to offer as a field in general. After I mention some thoughts, please go ahead and do your research, okay? Don't take my word as a set in stone. I did a little bit of research before coming up here, but still, I think this video is just to give you like a general idea of like paths you can go into nursing as a field, but then definitely do what's best for you, your family, financial wise, and yada yada yada. Okay. So the first thing I want you guys to know is there are different programs into getting into nursing. So you have your associates, that's your ADN. You've got your bachelor's, that's your BSN. You've got your master's, that's your MSN, Master of Science in Nursing. Every level of program has their pros and cons, right? I think one of the cons would definitely be the money, okay? It would also definitely be the money, okay? And then it would also definitely be the money. Nursing programs are so expensive depending on how high you go. So I think as an associate, it might not be as expensive as a bachelor's would be. And another plus of why an associate would probably be a good place to start. Not that I'm advising that. I'm really not advising anything. I'm just making you guys weigh the options, the pros and cons. So pros and cons of being in an associate degree. Typical associate degrees are usually like 2 years. Yeah, because then you're counting your prereqs too. So it's usually 2 years. You can do that in your community college. And community colleges are not as expensive as say a normal 4-year college degree. And then once you're done, you can take the NCLEX. I think it's the NCLEX PN that you did take. Pass your NCLEX and you start working. And then with ADN, you can also pursue a BSN while you're working as a nurse in your hospital. Sometimes the hospitals have like a bridge of like a ADN to BSN bridge, and that's really wonderful if they have that. Now as a bachelor BSNs are usually 4-year long college programs. Now you know 4-year programs are gonna be more expensive than what an ADM is. The 4-year programs are usually like 2 years prereqs, if I'm not wrong, and then 2 years of the actual nursing stuff, and maybe 1 year prereqs and then 3 years of, and then you get your BSN. And some people stay like that. Some people are perfectly fine being as a BSN, working in the hospital, like that's their like career, like they're done with school. Now if you want to take it further, you go take your, from a BSN you can go into a DNP, that's the doctorate, or from your BSN you can go into your MSN, that's the master's, depending on what you want to do. Now for MSN, as somebody that doesn't have any like nursing background like I did, as coming out of bachelor's with a biology degree, I also being an international student had to weigh my options. So basically, since I did my bachelor's in biology and I worked in the United States using my OPT, that's optional practical training, I couldn't go back for another second bachelor degree because I wouldn't be able to work in the United States. And I chose to do an accelerated master's entry level into nursing. I think that entry level is very important because there are a lot of accelerated master's program that would either be catered to like the education part of nursing or the public health side of nursing versus like the bedside, what you know as going into the hospital and all that stuff. Now the accelerated master's programs are also expensive, especially for an international student, but the good things about the accelerated programs is you know that once you get in, by God's grace, you get out. So when you think about like the accelerated part of nursing, you got your accelerated BSN and you got your accelerated MSN. The pros and cons for that. The pros I would say is they're both fast-paced programs. So that's like 16, 18, 19, 20 months program, almost 2 years. Give or take. The pros is that you learn a lot. It's very centered on nursing. You've already done your prereqs, okay, that's gone. So it's very like you're here for this reason and this reason only. Because they know you're accelerated, they try to give you the most important things that is needed to be able to pass your program. In my experience, I feel like going to nursing school is just preparing you to take the exam, the NCLEX, and not really preparing you to be a nurse per se, because nursing in the hospital world and nursing in the textbook world are two different worlds, okay? And you might probably hear that once you start nursing school. They're two completely different words. So going to nursing school is basically there to help you learn about nursing and pass the exams and go get your NCLEX and pass the NCLEX. That's what nursing school is there for you for. Now the cons about being an accelerated program is the expenses. Not even talking about tuition and stuff, like the books, the online resources, all this other stuff, your scrubs, the bag that they will give you because it has all your lab stuff. Everything adds up, and so that's expense on its own. A con about it is if you, God forbid, like fail a class, it will literally push you back for like 4 months, which is a semester. It will push you back and you won't be able to graduate on time. Let's say you fail Med-Surg 1. Because it's not offered every semester, because it's an accelerated program, you would have to wait until it's offered like the next semester after that. Does that make sense? Great thing with accelerated like programs is sometimes you can get the bridge program. Again, if you want to move forward with your career, you can get an MSN to a DNP in that school that you're in, and that could be helpful because maybe you've done like one class in your now accelerated program. I wouldn't say faster, but at least you'll be short 2 credit or 3 credit depending on what your school offers to be able to graduate. I've talked a lot. I think that encompasses all the programs, and hopefully that helps you decide on what to do next with your like nursing career journey.